I think, yeah, hello. Welcome everyone to the public session of the Oversight and Engagement Board meeting for the 23rd of July. The time is 10 a.m. We've had a very interesting session earlier and now we're moving to the public session. We'll go straight into number 8 on the agenda, which is the summary of local surveillance data, and it's over to Lucy Whiteman, our Director of Public Health. Thank you, Lucy.
Thank you, Chair. So as a brief summary, at the moment in Northamptonshire, as people will be seeing from the public data, we have 21,000, over 21,000 tests having happened in Pillar 1 and nearly 14,000 tests having happened in Pillar 2. So our testing regime is well established, but we have noticed over recent weeks that there's been a fall in the number of tests being undertaken recently, which is a concern. And over the last few days, we've been discussing how we can make sure that is improved upon, and we can go into that in more detail in the rest of the session. But testing is well established. We have access and we have the capacity in the system. We just need to be reminding the public to utilise it whenever they are identified as a contact or they have any concern about symptoms for themselves or anybody in their household. As a result of the tests that have been undertaken, though, we have seen 86 cases in the last 7 days. As a total, we've had 3,388 cases. We do still seem to have a high incidence in Northamptonshire, and in particular, the data is starting to allow us to look at particular areas of concern. We put a press statement out last night that highlighted an increase in number of cases and the number of tests that are being undertaken being positive in Northampton, and in particular there are certain wards as well that we're going to start engaging with to make sure that testing is undertaken and that we can understand the community spread of the infection. This does seem to be affecting a younger population than the pandemic has previously, and that is thankfully resulting in fewer deaths, but there is still a significant risk to our vulnerable population if we do not understand and mitigate the risk around the current circulating virus load. So that community engagement and that community testing to make sure that we understand what's driving the higher rates locally is really key. From a point of view of outbreaks, we do continue to experience outbreaks in Northamptonshire. We still do have a high number of outbreaks compared to other areas, and they are spread across both residential care settings and also employment settings. So we are seeing more outbreaks in places like food production factories, distribution warehouses, etc. We're being really well supported by Public Health England to identify those and address them. But again, we need to make sure that workers are remaining very fastidious about their maintaining social distancing, not just when they're in work, where they're getting additional support and reminders, but also when they go back out into the community. We have found that a number of these outbreaks are actually associated with people socialising in work groups outside of the work environment, but obviously are then testing positive within the work environment, and therefore the outbreak is associated with their place of work. So there's been some interesting insights, and we continue to work with Public Health England to understand the pattern of disease locally, but it really is a very stark reminder at the moment that increasing cases is the current picture, particularly in Northampton, but we are also aware of the concerning trends in Kettering and potentially in Corby as well. So we are looking at making sure that our comms and engagement plan is robust, that it steps up to the challenge locally, and that we're clear with our messaging to the public about their continued responsibility to ensure their own health and protect those around them. Thank you.
Thank you, Lucy. I think all of us think that you, particularly you and all your team, have been doing some amazing work in this area since this all began, and we can only thank you for the hard work that you do. But it is, and I think we're all very happy with the way that you are proposing the comms and engagement plan going forward. It just reminds everyone that this health crisis is far from over, and that we still have to be very careful how we approach life and what the new norm is and things like that. And I think this will be very key going forward. So unless there's any questions on that item, can I bring you back in again on item 8, which is the local surveillance data, which
So that was item 8 for the local surveillance data. Would you like me to just introduce the communications and engagement plan?
Yes, sorry, I meant so we'll move on to the engagement plan. I do apologise. Sarah, are you there? Thank you.
Yes,
Sorry.
hi. Yes, for those who've just dialed in, just to make it clear, the plan for Northamptonshire sits behind the main outbreak prevention and control plan, with the overall strategic aim to assist in the prevention and control of the virus. The focus is to deliver proactive messaging and communications with a focus on behaviour change and active engagement in preventing and controlling further outbreaks. I know you've all had sight of the plan. Is it possible to, but what's the main, what you all really want to hear is what we're going to do, which is detailed, the communications is detailed on page 7 onwards. There's immediate actions followed by ongoing actions, and with the engagement activities all detailed on page 12 onwards, again, immediate followed by ongoing. I'm happy to take any questions in terms of that, the detail, or if there are any queries at all, I can address those now.
Thank you, Sarah. Could it might be helpful. I know there's quite a lot. Oh, hang on. It might be helpful if you ran through those action points verbally.
Okay.
Can you hear me? Thank you, Sarah. Thank you.
Let me try and do that now. Right, I'm just scrolling down to page 7.
Don't worry. While we wait for Sarah to do that, Sarah is actually the author of this paper. On the agenda, it actually has Liam Beasley down as presenting it, but Sarah is the author, so we thought it was better that she presented the paper. Sarah, are you ready?
Yeah, I am. There are 20 immediate actions. I'm happy to talk through them if you're happy to listen.
I think we should
I'm aware
talk.
that's quite a lot.
Yeah, I think it would be helpful to go through them in this meeting, if that's okay. Unless Lucy, you have a point to raise on that.
Okay.
I think it might be useful just to group them, because there's there are some things around media and web presence. There are some things around proactive media releases, and then I think particularly important at the moment, bearing in mind the position that we've just talked about with the increased cases in Northampton, it's about that move not just from communications but to the active engagement. So perhaps it's worth just sort of chunking things up rather than going through it line by line.
Thank you. That's a very good suggestion. Thank you, Sarah.
Okay.
If you can manage to do that, that would be great. Thank you.
Okay, so there's the immediate situation, normal, if you like, comms, which is web content, media releases, social media messaging, community rapid response messaging, outbreaks in distribution centres have been highlighted, which have actually been addressed with the media messaging around carpooling and commuting from bordering counties. There's rapid stakeholder mapping that's underway already. Digital targeting of Northamptonshire's hard to reach groups with Facebook ads and Snapchat. Language translation that's already in place, as you heard, with the top 10 languages other than English spoken across the county. Compliance with certain groups has been highlighted, which needs to be understood and addressed immediately. Marketing uplift, so we'll be having targeted mail drops, door drops, road signage, buses, bus shelters. I spoke to somebody yesterday about that happening digitally across the county. That's happening already, but we're going to try and do it in different languages as well. Further outreach to businesses via the chamber, health and safety officers already on the ground, employers cascading messages. We've got the school cells and the other cells that are already in place, which will cascade messages to all their contacts. And then I think Toby mentioned before, harnessing the assets we've got basically across the GP waiting rooms, clinical settings, hospitals, pharmacies. Speaking to travel providers, yeah, I've mentioned that. So that's the comms highlights. But I'll just talk through the engagement actions which are immediate. So we want to get out there, and basically that means being on the ground. So we want to get out to supermarkets across Northamptonshire so that we can target the vulnerable groups. It'll be a two-way engagement, so we'll be listening to what people are saying and addressing any queries they have, and also sharing any materials or advice where necessary. Redeploying street ambassadors, the community wardens, which were on the ground, I think, with the initially with the lockdown before, with the national lockdown. So redeploying them to support public health messaging. Return to the weekly meetings with community faith leaders, which is organised by the Social Impact Cell. Mapping community festivals, so we're aware, we know that Eid's on the calendar coming up soon at the end of the month. Enabling capable guardians in the emergency planning team to be harnessed as a channel to ensure a flow of community intelligence. Two-way engagement to all shops, takeaways and other food outlets. Okay, and then working with appropriate colleagues to deliver messages to our existing influencers, including the business leaders, school leaders, universities, emergency services, voluntary services. And we're also going to be targeting local celebrities, if you like, or anybody with a voice to cascade messages in however they normally engage with the community. I think that's, I mean, there are more ongoing planning actions, but they're the top lines really. As you can appreciate, there's a lot to do, but there's a lot we've thought about, and we're going to do it.
Thank you, Sarah. That's very helpful. I think it goes without saying that we're all very supportive of this paper and the plan. Can I take it as read that the board are happy to endorse this plan and to agree to the plan? Yep. Yep. I think that's everybody agreeing, unless there's any dissenting voices. Let me just. Yep. Okay. Thank you, everybody. That's brilliant. Thank you, Sarah, for that. And I'm sorry you had a bit of a technical hitch with getting your papers up on the screen, but you handled that admirably in the circumstances. Thank you very much. So we move on to item 10, which is the COVID-19 Contain Framework, a guide for local decision makers. And that goes to Lucy again. Thank you, Lucy.
Thank you, Chair. I thought it would be useful to just share this. So this is really a summary of the new powers that have now been awarded to a group of people in the local authorities. So it's a framework that obviously talks about how we make our decisions locally, how we are able to and encouraged to take action to ensure that the virus is contained. And I thought particularly pertinent at the moment with increasing cases locally, that we really had a look at what this suggests we do, how we can be supported regionally and nationally, and obviously just to refresh our minds on the powers that have actually recently changed. So it talks about the fact that obviously there are 6 principles basically to an effective implementation system for Contain, and that our primary responsibility, it's a very good reminder, is to obviously make the public safe, and that is also my statutory responsibility. So this is key to reminding us about what we need to be doing, and it's a key message as well to the public about the role that they also play in that, not just to keep themselves safe, but to also support the rest of the community, particularly those that are vulnerable and cannot support themselves. So we really rallied round, and we had immense public support in the first phase of the pandemic. And although it's very tempting with the relaxation of lockdown at a national level to feel like the worst is over, we certainly do have an increasing risk profile locally. So it is pertinent to think about that. So it talks about building on the public health expertise and to use a system approach. And Dr. Jones from Health Watch earlier also alluded in the private section to the fact that we have had a very system-based response to the pandemic locally, and you know, we continue to be able to celebrate that. It's really key that we continue as a group of agencies to work together to address this, because there is no way that public health alone, as a very small team in the grand scheme of things, can address the challenges. Key to some of the local messaging and addressing some of the local challenges going forward will be the use of the environmental health officers and engagement at a borough and district level. So these are the leaders and the workers who know their populations best, and we're going to be very reliant on their support and their insight into how best to work with the local communities to make sure that we do dampen down the hotspots that are starting to pop up across the county. So we've started to be, now that we have access to it, open with the data that we are receiving, so that everybody can also see for themselves on a weekly basis where those hotspots are occurring. So people are aware that they are in Northampton and there are wards, etc., that are particular hotspots. At the moment, we are focusing on Castle Ward in Northampton. But there are other areas that are close by, Abington, etc., that also have high case numbers. So we are doing much more targeted work, and that's linked in with all of the work that Sarah's just outlined. We're building that consensus because we're working as a system between decision makers, and we want to make sure that we continue to be trusted by the public to do the right thing, and that we continue to be able to trust in the public to do the right thing. It is a joint effort. We will not be able to do this alone, and we will not be able to, as I said, dampen down those hotspots that are rising in Northamptonshire without the support of the public. So we need to make sure that that is ongoing and two-way engagement and communication. So we have got well-established emergency practice and preparedness principles, and those were executed very early on in the pandemic, and very much with a framework for that collaborative working that I mentioned earlier. And of course, we've got to balance all of this with the fact that there are, quite rightly pointed out in this framework, equality, economic, social issues that we also need to balance. So we're going to have to make sure that we consider the impact of our actions, but we do have to put the health of the public first, and we need to make sure that we get through this short-term period for the benefit of the long-term return to normality. So I think they're really good principles to remind ourselves of why we're here and what we're doing. So it talks about the local powers, and people will be aware of the fact that we have been given more local powers to be able to restrict movement of individuals, and also to close settings if they are identified as being related to high risk, or explicitly related or correlated to outbreaks. So those powers have been devolved to the Director of Public Health, the Chief Executive of the upper tier local authority, and the Head of Environmental Health Services at the lower tier authorities. So again, you can see how we need to work hand in hand with our lower tier authority colleagues to make sure that we collectively identify and agree on the actions that need to be taken, and very much then require the support of the police to enforce those actions if they need to be taken. So again, it's not that I'm talking about this as this being a necessary step at this point for us, but it's worth reminding ourselves, because this is such new legislation, that we do now have powers should we not end up being able to manage the current issues. We also know that things like the mandating of use of face coverings is starting to be more commonplace nationally, but again, we have the ability to look at that locally, and we have talked about earlier, but reinforce again those messages around the fact that the face coverings are required in shops as of tomorrow, and particularly when we have high case rates in Northampton, where we have a significant high street and footfall. That again will be being reinforced, and we'll be looking to our community volunteers, our environmental health officers and the public health experts locally to help reinforce those messages, and we'll be reliant on the public to obviously comply and make sure that they recognise their role in reducing risk locally. A lot of the other powers and references already exist and are already in our outbreak plan, which we will be updating based on the fact that these new legislative powers have been announced. And it just obviously talks about how the test and trace system plays into this. We still have that national system, and we still need to actively encourage the public to engage in that. So if they identify themselves as a case, that they are still required to immediately self-isolate, and they are still required to seek testing as soon as possible. Everybody within their household, unfortunately, will need to self-isolate at the same time. And it's really key that it is everybody who lives in that household that undertakes the same actions. Anybody who is contacted as a contact of a positive case, again, needs to recognise their role and responsibility in then also adhering to guidelines and seeking testing themselves if that is felt to be appropriate. But their self-isolation period continues to be 14 days, and it's steps like this and compliance on these guidelines that will allow us to get back on top of the current situation. So I think it's a useful reminder to us of the powers that we can move to should we find that the situation continues to become an issue. But at the same time, it's a useful reminder, I think, to the public of the role that they play in managing the outbreak locally. I'm happy to take any questions. It is quite a lengthy document, but please feel free.
Thank you, Lucy. I think, as you say, it's a very good reminder of the powers that are available, should they be available. And obviously, as a board, we would be there to support you and your public health colleagues in any actions that you might deem necessary in the circumstances. I think this board is a very good representation as well, of course, of the county. It's drawn from lots of different bodies and health, all sorts of places. So, and the police are here. I know the chief inspector is here today on the meeting as well. So we're all here to help you and make this work for the people of Northamptonshire and Northampton, and particularly in these hotspots. So I think it's really, I must commend you again on the hard work that you've undertaken to make this all happen today. Thank you very much from me as chair, and certainly thank you very much from everyone on the board. I don't appear to have any questions on that item. Toby wanted to come. Oh, and Chris. I do have a couple of people. So Toby first, then Chris. Thank you.
Thank you, Chair. And it's a comment as much as a question, and then an offer, really, Lucy. And it's a comment that links together the last three items that we've covered in this, and to kind of reinforce some of the messages that Lucy shared with us. From an NHS perspective, as the Chief Executive of the local commissioning group and all of our NHS partners, we saw in the early phase of the county's response to the COVID incident locally during those 3 or 4 months, a tremendous multi-agency response across all parts of the public sector, the voluntary, the community sector, local businesses, massive community effort into this. What we're starting to see, and that created the headroom that actually protected and created the space for the NHS not to be overwhelmed as we went through that period. I think what we've seen in recent weeks, both in surrounding areas and other parts of the country, is how rapidly we can see cases starting to step back up, and that can spread and develop in local areas. And we've been monitoring, I know Lucy and her public health team share with us that information openly around the positions in surrounding parts of our county. And in many respects, it's no surprise, given what we've seen in Leicester City and in some other areas in Peterborough and Luton and so on, that we're starting to see some of those cases increasing back up in the Northamptonshire area. I think from a health perspective, that really reinforces the importance of us absolutely getting behind the comms and engagement plan here. The logical proportional next step is we need to be really clear, really explicit, really open with the public about some of those tailored messaging. I know that's what's intended and that's what's in the plan. And so it's really a big thumbs up from our perspective to support and put our weight to that. If we don't do that, and if we don't help the public to recognise the significance of the phase we're still in, there is a risk that we progress further through some of those escalated states, and that some of the areas contained in the national framework Lucy's walked us through will be things that we'll find ourselves in the territory having to put in place. We would all rather, because of the consequences we all know from an economic, from a social, from an environmental perspective, not get into that arena, but that is going to be so dependent on our ability to pull together again as a system, as a society, as a community in responding to that. And the offer bit in all of that, Lucy, is the resources of the NHS are there at your sort of kind of call to help support in those messages. We have general practices, community pharmacists and others across the county who have that reach into their local areas. So we're absolutely up for and supportive of working to play our part in communicating those really important messages. Thank you, Chair.
Thank you, Toby. I've got Chris Lofts, I believe, and then David Jones again. Chris.
Thank you, Chair. I mean, again, supporting all that's been said, but I think that the other thing I'd like to just add in is that there's a danger that across Northamptonshire, we see this as being a problem just for Northampton and Kettering. And I think it's important that the communities across Northamptonshire also recognise that they've got a role to play, because as we know, the virus doesn't know of physical boundaries. And I think that it's up to those communities surrounding what are currently the hotspots to also be vigilant, because we just don't want this to spread any further. Thank you.
Thank you, Chris. That's a very valid point, actually. It's very easy when there's an outbreak or rising numbers somewhere to think, well, that's their problem and not everyone else's problem. And it needs to be everyone's problem, as you say. So you make a very good point there. David, are you there?
Thank you, Chair. And from Health Watch, which is the statutory body, the body that's set up in law to speak for people who use health and social care services, I'm the chair of that body. So that's my contribution to the discussion, and fully supports the comments about the fact the plan is good, and to welcome the good working between the different agencies. Just one comment, Chair, as we've been having a comment about the representativeness of this group. I think it might be worth, outside the meeting, having a little bit of a reflection on whether the group reflects everybody, or whether we have advisory groups from all the communities that live in the areas that are most highly at risk. I'm just looking at the screen, thinking that it would be good for us to make sure that we are demonstrating that we are in touch with all of the communities affected. Secondly, the simple messages seem to me to be coming over very clearly. First of all, we expect the public agencies to work together, and they are, to tackle this virus. All of us individually, every member of the county has a responsibility to think about whether we are the person who's passing on the virus. And we don't know. That is one of the things that we've learned, that we don't know if we necessarily have it. So it's down to all of us to be careful in our everyday life, that we're making sure that we keep that social distancing, and that we use face coverings, and we go for testing. And let's be honest, this is making people cross and irritated. I think we need to understand where people are. I'm really pissed off that my summer has been totally messed up because of this thing. And I'm looking around to say, who can I blame? And of course, there isn't anybody you can blame. But all of us are feeling frustrated. But we've got to learn that we're going to have to live with this. And we've got to be responsible about it. And if we aren't, then we will be back in a situation that is difficult. So I think we have to, all of us, be responsible. I fully recognise the public agencies' messaging, and we're keen to support it. But it's important that all of us in the community take those personal responsibilities, every single one of us. And then that way we can make sure that the virus doesn't spread through our county. And Health Watch will be watching carefully to make sure the agencies are responding carefully. But we're also keen to make sure that, and just to finish, if we don't, there are lots of people who've got other health conditions who are waiting for treatment or are wanting to get in for treatment. And I'm worried about those people as well, who need to have treatment for cancers and other things. And let's remember that if we don't take these things carefully, we're making it worse for other people. So the simple message is, all of us have to take that responsibility carefully. Thank you very much.
Thank you, David. Some very valid points there. And of course, we have to be aware of winter and winter pressures and flu and lots of other things. I mean, if people are under the misapprehension that this has gone away, I think winter could be a rude awakening for some people in the country, never mind the county. And of course, we'll be prepared for all of those things. And that's one of the things that we're trying to do here, is make sure that we're best prepared for all eventualities. Anyway, Lucy, did you have any further comments, or shall I move to any other business? That's up to you.
I'm quite happy to move to any other business, but there was something that I did want to raise. I thought it was just worth us touching very briefly on the actions that we've agreed as a result of the identified increase in cases in Northampton. I think it's really key that obviously we make sure that's publicly discussed. We obviously have had guidance from regional and national colleagues on what the best practice is around next steps. So they're using learning from Leicester City and from Blackburn and Darwin and other areas that have had increasing case rates. But one of the things that is outlined in our communications plan, but that we've started to sort of put meat on the bones to, is that much more visible engagement. So this is more than just messaging. Our messages are becoming much more directive, and they're becoming much more geographically specific. But it's about the work that we're going to be undertaking with Public Health England to directly engage with recently identified cases to understand their behaviours and where they may have contracted the virus from. Because one of the challenges locally is, although we have a number of outbreaks still across our county, that doesn't appear to be what's driving our increasing case rate. Our cases are seemingly quite distributed across Northampton as a borough, and they are also an unusual age range that's being affected. We know, when we talked about previously, that the initial part of the pandemic was very much focused on older people, people who were multi-morbid, had a number of underlying conditions. At the moment, the virus seems to be much more affecting our younger population, so 20 to 30-year-olds. So again, they have very different behaviours, both socially, and particularly with the reopening of pubs, the imminent reopening of things like gyms. We need to remind that group of people that their behaviours are still just as important, although the virus may not affect them in the same way, and may not make them as ill as potentially our older population. They are still a potential conduit and a route for transmission to other people who are much more vulnerable. So it's understanding where they may have contracted the virus, and as I said, Public Health England are using their behavioural insights team to help us start to do that, but then also make sure that that's used to tailor messages that are very specific to the causes that are identified as we go through this process. The second element I wanted to mention was that engagement piece. So we are working on a programme to make sure that the enforcement of social distancing and the reminders, the visible reminders to the public, are physically located in their communities going forward. We need to make sure that we learn, as I said, from areas like Leicester City, where they have had people visibly on the streets, reminding people about best practice, reminding people about hand hygiene, reminding people how to access testing if possible, so that again we can be able to point to the support that people are able to access and make it as easy to access as possible. I think it's easy to forget now, we're this far through the pandemic, that some of those fundamental principles about hand hygiene, getting tested, and social distancing are still our best defence. So yeah, there are next steps, and I just wanted to make sure that people were aware of those. If they had any suggestions, then I'm more than happy to receive those.
Thank you, Lucy. I think it's a very, very good plan. And I think our next meeting, whenever that might be, will hopefully wash out how that's been going. But it's very obvious that without a vaccine, this isn't going away anytime soon, and we have to remain vigilant, as you've very clearly said. So unless anyone's got any questions for Lucy, I'll move to any other business, if anyone has any other business. I'm not seeing any hands up. Thank you very much, everyone. The date of the next meeting, we haven't actually set a date, as I understand, but I think that will probably, we'll probably try and set up regular dates so that people can get them in their diary easily, and that's something we'll work on in the background. And we'll also presumably be working on yes, Lucy, hi.
I just wanted to say that my recommendation at the moment, under the circumstances, because of the increasing position and cases in Northampton, would be that we have weekly meetings. I do recognise that can be a challenge for people's diaries, but I think until we've managed to unpick the cause of the potential increasing cases, and that we're confident that the public and our local economy is responding appropriately, that we do need to make sure that this group is meeting on a regular basis.
Okay, Lucy, thank you. That's a very good suggestion. So we'll come up with some dates. I mean, they may have to be quite quickly put in depending on how things move. But what we'll try and do is set up a weekly meeting. And if we don't need the meeting, we can always not have it. But I suspect we'll probably need them going forward for the next few weeks. So that's something we'll take offline. So the date of the next meeting will be set there. All I can say is thank you very much, everyone, for coming today. And thank you for all your input. And thank you again, Lucy, for your hard work. you might be able to go home and have some rest. I don't know. Is that allowable these days? But thank you, everybody. And I'll see you at the next meeting, which we will set up soon. Thank you very much. Stay safe, everyone.
Bye-bye.
Have a good weekend.